Our teeth are tough, but they're not invincible. Over time, they can wear down. This is called tooth wear. Several things can cause this. One common cause is bruxism. Bruxism is when you clench or grind your teeth. This often happens at night. Acid erosion is another culprit. Acidic foods and drinks can wear away tooth enamel. Our diet also plays a role. Sugary and acidic foods can weaken enamel, making it easier to wear down. Even brushing too hard can contribute to tooth wear. Worn teeth can cause several problems. You might notice your teeth becoming sensitive, especially to cold or hot foods. Worn teeth can also look different. They may appear shorter or have a flatter shape. As tooth wear progresses, it can affect your bite. Your teeth may not align properly, making it harder to chew. This can even lead to jaw pain and headaches. Thankfully, we have many ways to fix worn teeth. These treatments can restore your smile and protect your oral health. Direct composite restorations are like tooth-colored fillings. They are applied directly to the tooth and shaped to restore its form. This is a good option for minor to moderate wear. Veneers are thin shells that cover the front of your teeth. They can improve the shape, color, and size of worn teeth. Veneers are more durable than composite restorations and are ideal for moderate to severe wear. Full crowns are caps that cover the entire tooth. They provide the most strength and protection for severely worn teeth. Crowns are custom-made to fit your tooth perfectly. Tooth wear is common, but it doesn't have to be a life sentence for your smile. Addressing tooth wear early is key to preserving your oral health and preventing further damage. With modern restorative dentistry, you can restore the function and beauty of your smile. Talk to your dentist about which treatment is right for you.